Megan. I'm the Adult Services Librarian here at the Eola Road Branch. Yeah. So that means one of my jobs here is putting together fun programs and informational programs like this one. So we have with us today also Megan from the Social Security Administration. So she's just going to talk to us about some of the basics of Social Security. We're just getting started here on the Social Security journey. I will be periodically checking on the Zoom chat. So it's totally okay to throw questions in the chat if you have those. I will make sure we get to those at a point in the presentation. All right. Well, thank you so much for joining us, Megan. Go ahead.
Great. Thanks so much for having me. Just a little bit about me. I've been with Social Security for going on 20 years, and I'm a public affairs specialist, and I've been in this position for almost 8 years. And I'm actually located in Peru, Illinois. So that's why I'm coming to you via Zoom. But I cover 17 offices in northern and north central Illinois, including the Aurora office as a public affairs specialist. So we're just going to start with the basics and an overview of all of the programs. We'll probably do questions at the end unless it's something really urgent. That way we can make sure it doesn't get answered, within the presentation. And I will definitely stick around for however long is needed to get any questions answered when we're done. Just to start with, as far as the basics of Social Security. Now, many people know this, but just a reminder of the backbone of the program. So FICA taxes are what you're paying into the Social Security system. So FICA stands for Federal Insurance Contributions Act, or it might show as OASDI, which is Old Age Survivors Disability Insurance, or Social Security taxes. Any of those ways it might show. I think my W-2 says Social Security taxes. That's a federal payroll tax deducted from your paycheck that's matched by an employer, and then it's reported to IRS by the employer. So we get your work history. I'm sorry about that. We get your proof of wages work history every year from the IRS, and that's what goes into your Social Security statement. So with Social Security, you do have a different max amount we tax every year for Social Security taxes, but we keep going on Medicare taxes. So you continue to pay Medicare taxes on all of your wages. Total FICA taxes is 15.3% of your gross wages. And what this is doing when we're paying in now is helping fund Social Security, retirement, disability, survivors, and Medicare insurance. Now, about 180 million workers, or 94% of workers in the United States, were covered under Social Security last year. In Illinois, we're actually a state that has quite a bit of people who do not pay into Social Security. That's because our public school teachers, City of Chicago employees, a lot of police or firemen, state university, judges, all of those categories do not pay Social Security taxes. So I also help with Wisconsin when my colleagues gone. All the teachers pay in Wisconsin. So not having paid in Social Security is much less common in many states. But in Illinois, we have a fair amount of people who do not pay in. We're going to start by talking about our disability programs, and Social Security has a very specific definition of a disability. So for adults, we are looking at whether a person has a condition or combination of conditions that's preventing substantial work and is expected to prevent substantial work for at least a year, or is like a terminal illness expecting to result in death. Now, disability isn't always something that people are thinking about when you think Social Security, but it is, a chunk of our beneficiaries are receiving from those disability programs. So for adults, we have this definition of disability. Substantial work is a dollar figure every year. We also call it substantial gainful activity. This year, it's the ability to work and make $1,550 gross a month. So our definition of disability is very strict with Social Security. It's different than the VA's definition or another organization's definition. Under the umbrella of our disability programs, we have two different types of benefits we screen eligibility for. So for Social Security disability, or SSDI, because government loves our acronyms. So SSDI is when you've worked and paid into the Social Security system. You're working, you're thinking most of the time you're thinking about your retirement, but it's also, we're here for you if you should become disabled and unable to work prior to that retirement age. So you can actually file for Social Security disability as long as you're younger than your full retirement age, which we're going to talk about a little later on. But let's say that you're 62, 63 years old and you go out of work, but it's not because you're really excited and ready to be retired. It's actually because of medical conditions. In that situation, you would, or even younger than retirement age, you would want to look into filing for the disability. The other benefit we screen individuals for who are filing for disability is supplemental security income. We call it SSI for short. So this is a federal program that provides monthly payments. They're intended to be for basic needs like food, clothing, shelter to people who have limited income and resources. Something that's different about this is we actually can pay children or adults with disabling conditions who meet those income and resource criteria. And then anyone over the age of 65, that is an aged benefit. So if you're over 65 with limited income and resources, you can file for SSI without needing that medical decision. Just a little recap on the disability section, and there's always infinite amount of more information available on ssa.gov on any of the topics we're talking about today. So we're just doing, like Megan said, a broad overview today, but we have a detailed information on our website where you can look into things more. But again, as the differences go, Social Security disability, or SSDI, that's coming from those Social Security trust funds. The amount you're paid out monthly is going to be based on your earnings. And it's an insurance that we're paying into. And you could receive a Social Security disability benefit regardless of how much income and resources you have. So you can live in a mansion, you can drive a Rolls Royce, you can have $1 million in the bank. You can still get Social Security disability because it's not a needs-based program. It's just you're going to get what, based on what you paid into, back out monthly if you're found medically disabled. And with Social Security disability, there might be benefits eligible for other members of your family, such as spouses or children, other people on the record. Whereas with SSI, or supplemental security income, these payments are coming from a general treasury fund. They do not take away from the Social Security Trust Fund. So a completely separate fund. And they're not based on a person's earnings. Payments are going to be based on whether income or assets they have, and living arrangements, all sorts of things go into play with the SSI program. And this benefit, like I said, children with disabling conditions could receive it as well as adults, but again, meeting that financial test. Then moving on next to kind of what people really think about when you think Social Security, and that's your retirement benefits, because we're always dreaming about that retirement party, right? So especially on Mondays, I think it's probably extra in people's minds when you're at work, right? So how you qualify for retirement benefits is when we're working, we're paying those Social Security taxes, and we're earning credits. So retirement, you just need 40 credits in your lifetime to be able to draw a retirement benefit. So as long as you get to 40, you're going to be eligible for that retirement benefit. You can earn up to 4 credits a year. This year, you only need to make $1,730 in Social Security tax earnings to get your 1 credit. So $6,920 this year would get your 4 credits for the year. And anytime we have a cost of living increase, which we do not know what it is yet, but we should be probably finding out fairly soon. Anytime we do have an increase in that, all these figures are going to go up. So all this information is accurate as of September 23rd, 2024, if you happen to be watching the recording later. So you can get 1 credit a year for 40 years, or you can get 4 credits a year in 10 years. I think when we used to send out those Social Security statements in the mail every year, when I was 26, I had my 40 credits already. So I could have technically stopped working then and been able to draw a benefit as early as age 62. But of course, when I was looking at that monthly estimate, I might have had enough credits for retirement, but my check wasn't going to be very much because I hadn't worked too many years yet in full time employment. And how we determine your Social Security benefit is the first thing we're going to do is we're going to take your wages and adjust for them for inflation. And then we're going to find the monthly average of your 35 highest years of earnings. And we're going to apply a formula to that. So if I had stopped working after 10 years of work, I said, hey, I got my 40 credits. I'll just coast on, I don't know what, till retirement. I would have had a lot. I would have had 25 0 years in that computation. So it's okay if you don't have 35 years total of earnings. They'll just be zeros within your computation when figuring your benefit. Now, if you're somebody who loves doing math, that's not me, but if you really enjoy spending your free time doing math, you can go on the Social Security website and it'll give you the computations to manually like index your wages and go through that 35 highest years and let you do the formula by hand to calculate your retirement benefit. Or, like we're going to talk about toward the end, you can set up an online personalized account, yeah, my Social Security account, and it'll just be there for you without any math required, which is how I get my estimates. A lot of people contact Social Security and they'll ask us, when should I start receiving my Social Security retirement benefit? And the answer is we can't tell you when to do it. All we can do is provide you the information on what your monthly payment will be every single month between 62. So that's your earliest you can draw a regular retirement benefit, goes up every single month you wait until full retirement age. In the example here, the full retirement age is 67. And then say you're not ready to even file yet at your full retirement age, you continue to wait. You can wait up until age 70. And between full retirement age and age 70, you're earning what we call delayed retirement credits. And those are going to average about 8% per year. So there's going to be a lot of external factors that go into that decision that we're not able to coach you on. You know, some people might use a financial planner, some people are just going to run the numbers themselves and see what would be the best option for me. Now, if you're looking at this, you see at 62, this person's eligible for $1,400 a month. And you see if they max it out at 70, then it would be $2,480 a month. So you're thinking, well, that seems easy. It's going to be over $1,000 a month more if I wait until age 70. But the thing to consider is that person at age 62 is getting 8 more years of benefit checks than the person who is waiting. So let's say let's do 1,400 times 12 times 8. So that person at 62, they've collected $134,400, and that's without the cost of living increase, while that other person was waiting. So some things you might consider are longevity in your family, because this person, what we call their break even point, or the point where they were no longer advantageous to take it at 62, it might be 15, 20 years from their filing date. So they might say, well, people in my family don't always live to be that old. I'm going to go ahead and take my money, enjoy it. Someone else might say, I don't need the money right now. Everyone in my family lives to be 100, so I'm going to wait till I'm 70 to draw my benefit. And other factors might be health insurance, needing to work at least till 65 for Medicare age, and other savings, other retirement plans, all those different things. And your answer is going to be maybe different than your best friends or your neighbors or even your spouses. So there's going to be something that you need to choose when your benefits are going to start. All we can do is give you these figures. Now, full retirement age has actually been increasing. So it's possible that your full retirement age is younger than 67. But if you were born in 1960 or later, like myself, my full retirement age is 67. Should I go ahead and take it at 62, I'm going to have a 30% reduction onto, the monthly check I'm receiving. Some people right now are still in that middle ground, maybe 66 and 8 months, 66 and 10 months. That's the full retirement age. So, of course, in that situation, they're going to see less of a hit from taking it at age 62. One decision or one factor that is definitely something to consider when you're going to deciding if you're retiring or deciding if you're taking your Social Security early is if you're still working. Because we do have earnings limits when you're under your full retirement age. So you can see on there if you're under the calendar year in which you hit your full retirement age, that this year the gross yearly limit, and so this is gross wages or net earnings from self-employment. That's all we're looking at here. We're not looking at Social Security. We're not looking at other retirement funds, 401k payouts, anything like that. Just gross wages or net earnings from self-employment. This year, if you're under the year you turn your full retirement age, you can make $22,320. After that, we hold $1 for every two that you go over the limit. So let's kind of talk about how this works in real life, because there's a lot of different misconceptions about working and receiving benefits that I hear when people are contacting the office. So what we're going to do is if you're over the limit for earnings, we're going to ask you for those estimates when you file, and we're going to ask you to continue to report yearly to us your work estimate if you're going to be on under your full retirement age, going into the next year or the year after. And we will hold checks if you're over this limit. We hold $1 for every two. So let's say that you turned 62 in July. The first full month you're 62 is the first month you're eligible. So that was August. You filed with August and you're 62, and you told us you're making exactly $8,000 over that earnings limit, just to make this easy. So you're making $30,320. So what we're going to do, we've excluded the 22,320, so the remaining is 8,000. We're looking at half of that because we hold $1 for every two. So you're then $4,000 over our earnings limit. So you started your check with August. All Social Security checks run a month behind, so you would received it in September. But since you're $4,000 over that earnings limit, let's say your monthly benefits are $2,000 a month, we have to hold two checks before we start paying you. So we're going to hold August check and we're going to hold September's check in work suspense. And then we'll pay you October paid in November, November paid in December, and so on. The following year, we would start that process over with January of the following calendar month if you're still working and over that limit. So if you're just a little bit over the limit, might be something you're like, I'm still going to go ahead and file. And let's say we held those two checks in work suspense. What we do at full retirement age is recalculate your benefits, almost like you took it 2 months later. We get rid of what we call reduction factors for taking it early. And that's fine. But if you are $70,000 over that earnings limit, you're probably not going to want to file, right? And that's the situation where you're working and working all calendar year. But we do have another test we can use in the month we file, and that's the monthly test. And what that is just taking that yearly number, dividing it by 12, that's $1,860. So this would allow someone, let's say, you had turned 62 in July and you celebrated your 62nd birthday by retiring from your job. You're no longer working. You're like, I am out of here. I'm going to go enjoy what's left of the summer before the snow hits us in Illinois. So you made between January and July, let's say you made $100,000. So you're like, uh-oh, Megan told me I can only make 22,320, so there's no way I can start my Social Security. Well, because you are retiring, because you're stopping work, you can use that other type of test, the monthly test. So as long as you're going to be under the $1,860 a month, so if you're not working at all, that'll be easy to do. If you get a little part-time job, you want to stay under that 1860 every single month for the rest of the year. Even though you made $100,000 already this year, we can start your benefits with August paid in September. So don't worry about the work, how much you made if you're going to be retiring from your job and starting your Social Security. You only need to be concerned about your amount if you're going to continue to work after you draw a Social Security check. So the year you turn your full retirement age, same basic premise, but a lot higher of a earnings limit. So some people are able to easily start with January of the calendar year of their full retirement age because that's that higher limit of 59,520. And again, you're going to turn your full retirement age the first day of the month in which it's your birthday. And so if you're turning your full retirement age in this month in September, it doesn't matter if you're turning it September 1st or September 29th. Your September is your full retirement age month. And so you could have made 59,520. We only hold $1 for every 3. The first day of the month in which you hit your full retirement age, that's when you can work and make as much as you want and still receive all your Social Security checks. And that's also the full retirement age when we consider you to be getting your unreduced benefit. It's not reduced at any point due to age. Whenever you file a benefit application with us for Social Security, whether it's disability, retirement, or if someone's filing a survivor's application, we always ask questions to make sure of anyone else that might be eligible for benefits on the record. So the first question we're going to ask, set of questions about that, we're going to ask you your retirement application is, do you have any children that are unmarried, under the age of 18, or up until 19 and still a full-time student in high school, so still under grade 12? And that's pretty common. A lot of kids turn 18 during their senior year of high school. We can pay till the end of the school year. Or that last category, 18 or older and having a disability that started before age 22. So we have benefits we call disabled adult child benefits that can be paid off a parent's record. And let's say your adult child is 35, 40 years old by the time you go to file, but they have had that disabling condition, maybe even since birth, but at least since before age 22. And they're not married and they have not worked substantially, on their own record, they can potentially get a benefit as a disabled adult child. So make sure you list them down, and whoever gets assigned the claim will be recontacting to go through more information and see if we have to get a medical decision to show that disability beginning before age 22 for those benefits. Then spouses benefits, this is where a lot of confusion really starts sometimes with people and their benefits. So the first thing I want to make sure everyone knows is if you have your own 40 credits on your own record, whether you are filing off a current spouse or a former spouse, if those spouse or former spouse is living and you have your own 40 credits, we always look at your own benefit before we pay anything off a spouse. So you're not choosing between yours or your spouse's. If you have 40 credits, we're going to pay you what we can off your own. So what we do, does not matter how old everyone is when we're filing. is first of all, if you're currently married, that person has to either be filing for at the same time or collecting their benefit already for you to receive something off their record. And then the next thing is we're always going to look at each person's own benefit. And regardless of what age you're filing at or what age they filed at, we're going to look at 100% of your own benefit. So your full retirement age rate. We're going to look at 50% of your current spouse's full retirement age rate. If 100% of your own benefit is more than 50% of theirs, there's no spousal benefit payable. And of course, if you're the higher earner, we're looking at the same thing for them. Maybe they can get off your record. It goes, either way. If it's less, then we're going to still pay you what we can on your own. And then the difference between 100% of yours and 50% of your spouse's off of their record. So you're not getting both full checks either. So let's say you're filing for a benefit and your full amount is $1,000 a month, and your spouse's full amount is $1,600 a month. In that situation, you're each just getting off your own record, no spouse's benefits payable. But let's say instead that yours is $1,000 a month and theirs is $3,200 a month. So half of that is $1,600. Then you'd be eligible for $1,000 on your own, $600 off your spouse. But if you are not at your full retirement age, we're then going to reduce that for age. So you're going to take an age-related reduction on that. Now, for spouses benefits, you need to be age 62. The exception to this is if you're caring for a child who is under 16 or has a disability of the worker. In that situation, you don't have to file your own first. If you're younger, you could potentially get that child in care benefit. One thing to know, though, that work situation we talked about earlier, that same work limit applies to everyone else who's filing. It applies to teenagers are working, spouses, former spouses, and survivors. Any type of Social Security benefit we're paying, other aside from disability, has that earnings limit up until full retirement age. Now, anytime we pay a benefit to a child or a spouse or a former spouse, those never reduce the payment to the worker of the record that's coming off. It's an additional benefit payable on the worker's record. So next category, divorced spouses. So a lot of similarities and some differences with this one. Similarity is we're going to look at the person's own record first. If you have 40 credits before looking at anything off a former spouse, the marriage has to have lasted at least 10 years. So that's specific to divorced spouses. You cannot be currently remarried to someone else. Now, if you were remarried after, but are no longer married to that second marriage or however many marriages long, you can then still look at that divorced spouse benefit. You just can't be currently remarried to someone else and draw off the former spouse who's living. Age 62 or older. Here is the big difference with divorced spouse benefits. Remember how I said for a spouse benefit, that spouse needs to be either filing or receiving? That is not the case with divorced spouse benefits. So you can receive off a former spouse or they can receive off yours, depending, again, on who's the higher earner, as long as the former spouse is at least age 62 and is eligible for Social Security, meaning they have their 40 credits or even if they're on disability. So that's the big difference with the divorced spouse's benefits. Then the final category of money benefits we're going to talk about is survivor's benefits. So rules as far as entitlement for children are the same: under 18, still in high school through age 19, or disabled prior to age 22. But for surviving spouses and for surviving divorced spouses, there are some differences off a survivor's benefit off someone who's passed away versus the benefit off someone who's living. So you can get survivor's benefits as early as 60. or as early as 50 if you have a disability, or again, any age if caring for a child of the deceased worker who is under 16 or has a disability. Another thing to note here, in the survivor situation, you can remarry after age 60 and still keep your eligibility to the survivor's benefit. And then the percentage for survivors benefits is different. So if you are receiving at age 60, you're going to get about 71.5% of the benefit. And this will increase up till full retirement age, up to 100% of your spouses or former spouses benefit at what they passed away. So it's a higher percentage. So here we're going to go through again, just a little breakdown to go over the differences between these two. So for off of somebody who's living, whether it's a spouse or divorced spouse, when they're living, the earliest those benefits start is age 62. The most you would receive off their record is 50%. It'll be less if you file early. Off somebody who has passed away, you can start those as early as age 60 or 50 if disabled, and you would be getting 71.5 to 100% of the benefit off the person who passed away. So we see it pretty commonly now that both members of a married couple have their own earnings records, and a lot of times there's no spousal benefits payable because both people have been in the workforce. However, if the higher earner passes away first, then we need to take the application for survivor's benefits because that is the spouse would then be eligible for that higher percentage off the records. So if you're not eligible as a spouse, if something does happen to, your spouse, if they pass away first, then contact Social Security to check in on those survivor's benefits. When I talked earlier about how you have to take your own benefit before we look at anything off a spouse, that is the rule when you're filing off someone who is living. That rule was passed a while back and it's called deemed filing. However, survivors' benefits are an exception to that rule. So you actually have some strategies you can use when considering survivors' benefits. So you just kind of, as long as you're listing all these situations down in your application, we're going to review for these situations. But you can also call and ask questions, get estimates when you're in your decision making period, because you could see your own benefits estimates online, but you wouldn't be able to see, your former spouse's benefits online. So you can take the survivor's benefit as early as age 60 and then switch to your own retirement as early as age 62 if it's higher, but you don't have to switch right away. You can keep letting yours grow up until even age 70 and get those delayed retirement credits on your own and then switch. Or you could even take the retirement benefit at 62 and then switch to the survivors later on up until full retirement age. Survivors benefits, any benefit off someone else's record is not going to grow after full retirement age. They don't have those delayed retirement credits, so you don't want to wait past then. Now, I know Megan told me they cover Medicare a bit at different presentations at the library, but I want to cover the basics because we do the enrollment of Part A and Part B through Social Security. And then we hand everything else over to the Medicare side or the private company side. So if you have 40 credits from your own record or a spouse's record or a former spouse, you do not pay anything monthly for hospital insurance. That's your Part A. That is only used when you're inpatient a night or longer. So even if you go in and out of the ER, that's not Part A. And it does have deductibles. And then Part B, your medical insurance, certain outpatient visits, outpatient procedures, certain medical supplies, those all go into Part B. Then I can tell you it was about 20 years ago that they added Part D because I am referred to as a Part D hire. So there was a wave of hiring when they added Medicare prescriptions, not because we do Part D plans, but because we do something called extra help. And that's helping people with limited income and resources to see if they qualify for assistance in paying for their Part D premiums or Part D drug costs. Now, this has always been, original Medicare. Like I said, Part D came around 20 years ago, and people can add supplements or Medigap, or they might use some sort of letter in the alphabet above the letter D. And then increasingly popular is Medicare Advantage plans, also known as Part C. In this situation, you still have to enroll in Part A and Part B through Social Security, but then the Medicare Advantage plan takes over everything else as far as billing. You don't contact Medicare, what they cover, all those things go through the Medicare Advantage plan. And they usually have a Part D plan alongside them. Some people like them because they might have vision, hearing, and dental, which are not covered that well through traditional Medicare. And we always refer people to the Medicare.gov. So always .gov with us and Medicare and IRS, but Medicare.gov for all other things Medicare. As far as the times you could get on Medicare, age 65 is the one we're going to focus on today. But you can also get on Medicare after 24 months of Social Security disability. So not SSI only, but Social Security disability. Now, individuals who are found disabled with ALS no longer have that 24-month waiting period. They're going to have their Medicare start right away, as do people who qualify under a specific type of Medicare called end-stage renal disease. People with kidney failure who are on dialysis or transplant can receive a specific type of Medicare for that situation as well. Age 65, your first opportunity to get onto benefits is your initial enrollment period. If you're receiving a monthly Social Security check before you turn 65, you will automatically be enrolled in the A and the B. The card comes in the mail about 4 months before your birthday. It comes at the same time that it seems like everyone in the world has found out you're turning 65 and you're getting a huge stack of junk mail every day. So please open your mail carefully, because I know that a lot of these end up in the circular file. So, because they come in a plain white envelope, it doesn't say Social Security on it because it's coming from Medicare. I believe it has a teeny little bird emblem in the corner. So please open your mail carefully and be on the lookout that if you are on Social Security benefits. If you are not on Social Security benefits, there is nothing magical that happens to place you into Medicare. So if you need it at age 65, you want to get in during that first opportunity, your initial enrollment period, the 3 months before your birthday, the month of, and the 3 months after your birthday. If you need it to start the first day of the month in which you're 65, be sure to get it done in the 3 months before, because if you wait till the month of your birthday or the 3 months after, it's going to begin the month after sign up. But you can take your retirement and your Medicare at the same time, or if you're not ready for retirement, you can file for Medicare only. The one thing I do want to mention here is if you're still working and you have a health savings account, you cannot contribute to your health savings account if you have Medicare. And IRS has some kind of tax penalties involved in that. So just be aware of that situation. You don't have to file for Medicare at all at age 65. If you want to, if you're still working and covered under group health insurance, if you're already automatically enrolled, you're going to be on Part A, because we cannot take you out of Part A if you get a monthly Social Security check, but you can still choose to refuse the Part B. That's the one that costs money. So if you are, these are very important, actively employed and covered under group health insurance through your employment. So those two have to be together, or your spouse is actively employed and covering you under their group health plan through their employer. You can wait for the Medicare, especially the Part B, and you can qualify for a special enrollment period. But be very careful, because this does not include the marketplace, VA health coverage, self-employment insurance. It does not include a retiree plan. It has to be both of those things together, active employment and the group health plan through the employer. Then you'll get that special enrollment period. whenever that work is coming to an end, you can get the forms and get that Medicare started. Because the employer is going to have to verify that you had that coverage every single month since age 65. Now, we do have some people sometimes that just genuinely didn't know they're supposed to sign up for Medicare, or we have some people that get in the Part A, but they say, you know what, I never get sick and I don't want to pay anything for my Medicare, so I'm going to refuse it. If they need Part B in the future in that situation, since they don't have the special enrollment period, they have to wait till January through March of every year. The coverage begins the month after sign up, and they'll have a 10% penalty onto the monthly premium for every year if they do not take the coverage. So that's why it's really important to do your homework prior to age 65 on this. Social Security will send out a letter if you are going to have a Medicare premium, an additional premium onto the base Medicare premium. So this year in 2024, the base premium is $174.70 a month, but some individuals pay more for their Part B and their Part D. So I'm not going to go through all the chart. This is available. Like I said, the PowerPoint is available on our website, and it will be in the letter if this is your situation. So you will get a letter about this. Again, this is another one. Anything from the government, actually, just please open carefully. But this letter will tell you if you're in the situation and you have what we call IRMA, or income related monthly adjustment. If you're falling into one of these categories, it'll talk about why. It'll explain there are some times where we can lower that premium if you qualify for a life-changing event. And it'll list what those life-changing events are. I'm not going to go through them all, but again, read the letter carefully, and there's a form you fill out. We can change it effective with the date we receive the form. If you qualify for a life-changing event, we cannot retroactively fix it. So if this is your situation, open that letter, get us that form. If you have that life-changing event, I'll just say one of the more common ones is work stoppage or reduction because you're retiring. So let's say you retired at the end of 2022. We're always using 2 years prior modify adjust gross income from IRS. So this year we're using 2022, but you say, hey, my income went down a ton for 2023 because I stopped working at the end of 2022. That's a life-changing event. You get us that form in and we can use 2023s instead. Now, Medicare applications, you can, like I said, file for Medicare only online. If you're under that special enrollment period, there'll be a couple forms we need when the time comes to get into the Part B. We need a 40B. That's the one that you fill out saying you're ready for that coverage to begin. The CMS L564 is the employer form that you or your spouse's employer completes. Then you can even submit those online now, or fax, mail, or drop them off at your local Social Security office. And then, like I said, Medicare.gov for all your other questions. They have a personalized account, or working with a SHIP counselor. There's SHIP counselors in Aurora, there's SHIP counselors all over the suburbs. The Senior Service Associates has them, a lot of other organizations has them. The reason I can tell you about SHIP counselors is because they are trained through the Department on Aging. They do not charge a fee, and they are not in charge of selling you a specific plan because they're not working for an insurance company. So if you need help for anything outside of enrolling in Part A and Part B, because that's all we do at Social Security, this is where you want to get help from. They're wonderful. I work with them on questions all the time. They can help with so many other things related to Medicare. So they're definitely worth checking out if you're coming upon that time, or even every year when you can change prescription drug plans. They are always busy during open enrollment because people can recheck their plans once a year and make sure it's still the best plan for yourself. As far as how to file for all the benefits we talked about, except for survivors, for retirement spouses, disability, or Medicare only, the easiest way is to file online. Do not worry, someone still reviews your application before we process it. You don't like hit the button and then you get a check. We're going to look it over. We're going to let you know if we need anything. So it's the easiest and fastest way to do things. If you are not able to file online, or you're needing to file for survivors, which is not available online, you can call and schedule a phone appointment. The majority of our appointments are being done over the phone still. What that allows us to do is move workloads around. So right now, my office, it's tiny, but we used to take claims for 2 to 3 other offices as needed. We had a person retire and 2 people go on to details in other spots. So now occasionally we're giving our appointments to other offices. So by doing them by phone, it allows us to distribute work and make sure to help those offices who might not have any openings for 2 months versus offices that might have an open calendar. But if you absolutely need an office appointment, you have a language barrier, you're experiencing homelessness, there's just, some other reason you need to go in the office for the interview, then you can ask for an in-office appointment when you schedule it. We are open otherwise to walk-in traffic though. So if it's just something fast, you don't need to interview for, you can go into the office. But most things you don't need to go in for. You can do them online. If you go into the office, just a heads up, we have different options for checking in. We have mobile check-in express, which makes it easier. You don't have to stand at the kiosk and put everything in. You can scan the QR code located at the office and just check yourself in for the visit. Otherwise, you can go and use one of these check-in kiosks. They're available at every office as well. And this is SSA.gov's homepage. So you should see this. If you don't see this, you went to the wrong site. So SSA.gov, this is the homepage. I heard someone talking about how you need to update your My Social Security accounts. That banner for a while has been at the top of the page, but what will be at the very, very top is whatever the hot topic of the moment is. Otherwise, the rest of this page looks the same, and it's worth exploring. There's a lot of great information for different people, types of employers, um, representative PEs, attorneys, educators. We have we have school lessons on here for online educator toolkit. So all kinds of stuff. We have calculators. The best calculator is within your My Social Security account. It's a retirement estimator that lets you play around. Like, what if I stop working now? Or what if I start making more money now? All those things. But we also have other calculators. So I talked about a lot of people, like teachers that don't pay into Social Security. If they have not paid into Social Security at all, they wouldn't be due any benefit off their own record. And they might be due something off a spouse, but the GPO or government pension offset would apply. There's a calculator for that. If they have their 40 credits and that TRS pension or other non-covered pensions, City of Chicago, whatever it might be, then the WEP calculator, windfall elimination provision, would be what you can use there. Life expectancy, if you're really interested in checking that out, and a lot of other calculators, earning tests to help you figure that out and help you decide when to file. Everyone over the age of 18, we encourage to create an online My Social Security account. And you can do this by, if you already have login.gov or id.me accounts, you can go in, every single time you're going to start on our website, go to ssa.gov/my account or find it off the homepage, sign in or create an account. If you already have that account, like I just talked about, I myself, I'm guilty. I have a username and password and I haven't done the thing to switch it to login.gov yet, but I promise I'm going to do it soon. But if you have a username and password, that's still working, but it is going to tell you they're going to phase that out and everyone's going to login.gov. They did not tell us that in the beginning when they switched to all this. They always said you'll be fine, but now they have said, nope, we're going to switch completely over to login.gov. So we use login.gov, but if you have id.me, like a lot of military personnel has that, or if login.gov is giving you problems, it's up to you, but you can create an id.me account. Some people have better luck with that, but either one works. If you've never had an account, you're going to go through create an account. It's going to direct you to login.gov to do the account there, then bring you back to our website. And then you're going to complete registration using an activation code. So I'm going to start actually with you're not on benefits first, because this is why we want everyone over the age of 18 to be creating this account. Remember how I talked about, I knew when I was 26, I had my 40 credits because we used to send those paper forms to every single person age 25 or older once a year. Well, as you imagine, that's a big cost. A lot of people, I'm going to tell you, we ask everyone if you reviewed your earnings record in a claim. A lot of people threw them in, again, the circular file where they keep the important stuff and never looked at it. And there's important reasons to look at it. We want to make sure your name, date of birth is right, and your earnings record is correct. So if you are 20 right now and you never set up a My Social Security account, and in 42 years we ask you, do your earnings look correct? And you're missing one from 2024 or 2034 even when you were working a good job. Guess what? We need a W-2 to get that added. So you're probably not going to have it anymore. So one thing we want you to do is just log in and make sure the earnings are posted correctly. Occasionally that process from the IRS does not go as well as we'd like it to. So we just need a W-2, no big deal. Or if you're self-employed, we need those tax forms. So the more recent that's been, the easier it's going to be to correct them. Also, maybe you have an 18 or 19-year-old that's like, hey, where is my Social Security card? I need a Social Security card. Well, you can say, well, as long as you have a valid driver's license, you have a state ID, please go online and get a new one because you know, I'm not responsible anymore and you're an adult. So anyone over the age of 18, just straight replacement card, and they're expanding more and more what you can do for cards. Like some states, you can do your name change if you're married or divorced on it. Right now in Illinois, we're just doing regular replacement cards. But those are a big workload. So if you can do them online, it saves you having to take off work and come into the office with your driver's license or state ID. If you're in the process of applying, you can check the status and get that Social Security statement, make sure everything's right. And then if you're on benefits, you can change your address, phone number, direct deposit, get replacement 1099s for up to 6 years, get a new Medicare card and print proof. Maybe you've had someone say, I need an award letter or I need proof of income because a lot of agencies ask for that. You can print that right from your online account. And if you like those statements, you can still see those within your online account. A lot of times financial planners ask for them. You can print it right up and take it to your account, to your appointment with them, or you can save it onto your desktop on a personal computer. We also include fact sheets to help you get ready for retirement, depending on your age range or situation. If you need help with that online account, or if you're helping someone, like I'm my parents' tech support, you can help someone as long as they're with you, physically with you. They have their own email address, or you help them set one up and they can answer the question. So you can do the tech part as long as they can answer the questions. And if you need help getting that registration process through, you can get a activation code from your local office with a valid form of ID by going in. But a lot of times you can get this done right from home without that. And of course, we always like to remind about scams, not just phone, but email, text message, QR codes, even now, are they're doing scams on. So just always beware. Know that Social Security never threatens you, never suspends a Social Security number, never demands immediate payment, especially through cash, gift cards, prepaid debit cards. If you do get a scam call like that, hang up and do not give personal information. And you can report it if you have time to oig.ssa.gov to help them track those. We are on social media, pretty much all the major platforms if you're interested in following us. And I'm going to go to questions.
All right. Yeah, does anybody have any general questions? Remember, we're still recording, but if there's things that you feel like might benefit other people to talk about. Otherwise, I'll turn the recording off in a minute.
Yeah, can I ask you something?
Yeah, sure.
My both parents are 80 plus and they don't drive to the social security office. So if I have question for them, so how is there any form I can have it for as a like approved representative? So they sign it at the home and I can bring it over there and I
Well,
can bring state ID and everything.
I mean, we the only thing you would really do that for is if like they need a social security card replaced, they could fill out the paper form and you could bring that over for them. Otherwise, if you call with them and they give permission to talk to you on a case by case basis, we can do that. The only time otherwise is if they become mentally unable to handle their benefits. So say it's not physical stuff, it's more like dementia or Alzheimer's. You could file to be their representative payee, and that involves receiving their benefits on their behalf. We have to verify capability with a medical professional. But otherwise, if it's just more physical limitations, the easiest thing to do is do the business over the phone. Say, help them with the phone, hand it over. They'll answer their security questions, and they can say, I give permission for my daughter to talk about my record.
Or if I want to go in an office in Aurora, that time I can talk to the live agent in front of me.
Yes,
So-
but we wouldn't be able to tell anything off your parents' record without them.
No, but that's what I'm saying, like, IDHS, they have like form, we can fill it out and they sign it, and I can become like approved representative. Same thing over here. Social
Yeah.
Security Office, they have it or not?
We have a representative payee, but that involves an interview. It's not just a form. And they would have to be found mentally incapable of handling their business.
No, they are not mentally problem.
So, yeah,
They are able to drive and,
Right, right. So
one
you would
month
just need to do it
covered.
on the phone with them.
Okay. But there is no physical, I can go in person and talk to somebody about them.
No, not without permission to give you access to the record, which is why usually people do it over the phone.
Oh, okay, okay, thank you.
I have a question.
Mhm.
It's kind of a personal question, but, I would like to apply for my social security retirement benefits starting the beginning of next year. Now, there was a security breach like with AT&T and they told us to freeze all our credit bureaus. Will that be a problem? Do I need to unfreeze it?
So this has been a back and forth answer amongst us. My latest understanding is that it should not be, but if it is, what you have to do, do you have an online account with us yet?
I do.
Okay, then no, it won't be any issue. It's only
Okay.
if you hadn't created it, yeah. If you
Okay,
haven't created one yet, sometimes people have to remove the block for a day, create the account, and then the next day put the block back on. But if you already have your account, you'll be good.
okay. And I did change it to the login.
Yep, so you'll be good.
And, I am self-employed, so what would I need to, put, input for the they need to see 2 years or something? I'm not sure.
I mean, only if we don't have your earnings posted from IRS. But you're just gonna give the estimate for your net earnings, if you're gonna continue
Okay.
working and you're at your full retirement age.
Okay, okay, great, thank you.
Okay.
Can I ask you
question?
one more?
He's got a question in the back. I saw his hand go up.
Yeah, I always heard that you can start collecting social security at 62 and 9 months. So are you saying that you can actually start at age 62?
Yeah, 62 has not changed as the early retirement age. The only thing that has gone up is the full retirement age. So 62 is the early.
And then one other question. If your wife is from a foreign country, what type of survivor benefits would she be eligible for?
Well, as long as she has lawful residence here, she'd be eligible for survivor's benefits just like any other spouse. The only thing with those is if you're receiving a benefit off another person's earnings and you go out of the United States, we can't always pay those if you're going to continually live outside the United States. There are some provisions on that. But if you go on SSA.gov, there's a payments while outside the United States little walkthrough calculator thing, and it'll tell you, if she would be considering leaving the country after getting them. You can pick like what type of benefit is, what country, and it'll tell you how that would affect it. But while living in the United States, as long as she has lawful status, so if she's a permanent resident or, whatever she might be, then, she can receive that survivor's benefit, same as any other spouse.
Okay, well, what if she lives outside the United States?
Like I said, it just depends on what the situation is. Like, I would recommend going to SSA.gov, and there's the payments outside the United States. So you could walk through, what country she's a citizen of, what country she's, potentially returning to, what type of benefit she's receiving, and it'll give you the answer there as far as if it would be payable or not while she's in another country.
Did you have, I'm sorry, she had said that she had another question.
Yes, please.
Mhm.
So I think I read something that we cannot create the account for other people, but my parents, 80+, they don't operate the laptop or any other device. So if I want to create the account for them, is it possible or not?
Well, you have to be sitting with them. So you would have to be like, you can't do it over the phone. So they have to be sitting with you. So you would, I mean, you can do it on a smartphone. If you have your smartphone with you and you're sitting with them, you can do it from a smartphone account. But it is their account for their use. You're not to be using it to log in as as them. It seems to be something that, you can help with, but you shouldn't be accessing without their knowledge or, doing without them.
Okay, so if I'm creating for them, then I have to use my information for them, like email address or phone number.
No, you need to get them their own email address. So you could set them up whatever free email address you want. But it needs to be there because everyone has to have a separate email address for these accounts.
And how about phone number?
Um,
Do they ask for the phone number?
They
No.
do to get a code sent. So you could instead have the code go to email rather than a text message. That is an option.
Okay, so without phone number, it go to email address, right? That code?
Yeah, they need their own email address, but like I said, those aren't too hard to set up.
So they can just I can just access their code by email instead of phone, and that's how I can create account for both of them.
They need their own email address and they need to be with you anytime those online accounts are being accessed.
Yeah, I can create email address for them, but that code will go to their email address, and that time I access and create the account for them.
Yeah, and you can create an email address from anywhere, a Gmail, a Yahoo. I mean, it's really easy to create a new email address.
I know that. Okay.
Hmm.
But
So,
the phone is not necessary. That's what I might concern.
yeah, everyone needs their own email address. You can't repeat an email address on the online accounts. And
Okay. Thank you.
They have both a login.gov and ID&Me. Which one should I be using? Because I've had trouble with the ID.Me.
then use login.gov. That's usually what I say is it's whatever one's working better for you. There's not a right or wrong answer. Okay, so do you see SSA.gov now? This is for the gentleman who was asking about his wife. So this is called Payments Outside the United States, Payment Abroad Screening Tool. You'll see it walks you through. It's really nice. It'll walk you through the scenarios so you can determine benefit payments. But yeah, for ID.me, we don't have a preference. It's that the government contracts with login.gov. It used to be one of the reasons was the ID.me used facial recognition in creating the account. I actually think login.gov is going to start doing that potentially too sometimes, or maybe already does. But that was one of the issues, staying away from that being why we contracted with login.gov versus ID.me. But login.gov is where Medicare, SSA, and a lot of government agents do. But whatever one works best for you is the right answer on that one.
I have a question. If you take your social security a little bit earlier than your full retirement age and you're working,
Mhm.
and you're still contributing into social security because you're working, will that increase your benefit?
Yeah, so potentially, we're always using your 35 highest years. So, and keep in mind, those previous years are indexed, so you can't look at their dollar for dollar value for, some people are surprised, but if it's replacing a lower earnings year or a 0 year, then it'll increase your check automatically. They do that run every fall in the computer system.